So good afternoon, everybody. It is March 25th, just a little bit past noon, and the weekly Nevada County vaccine update. And we're going to start with breaking news. And I think that all our three panelists have breaking news. So Ryan, why don't you kick us off?
Okay, so the breaking news that I'm aware of is that the state has announced an expansion of eligibility that will be coming first on April 1st, where everybody age 50 and over will become eligible for vaccine. And then on April 15th, when everybody 16 and older will become eligible for vaccine. So I think this is consistent with the movement that we've seen in some other states, and then nationally with the federal administration proclaiming that everyone is going to be directed to open it up to everyone 16 and over by May 1st. So California, not to be outdone, is jumping that by 2 weeks. So April 15th, everybody 16 and over will be eligible. They're saying that they're seeing that there will be a surge in supply that will make that possible. But I just want to emphasize that that we're going to continue to have the problem of expectations versus reality. Being eligible doesn't mean that there are going to be vaccines available for all the residents of our community who will be eligible at that time. We have 86,000 residents who are 16 and over. So even though you'll be eligible if you're over 16 on April 15th, there will still be it'll take some time to get through everybody. But the other thing they're saying is that we should have predictability around supply, at least in terms of a floor. And so we should be able to schedule out beyond just what we're getting next week. Right now, we're still with week-to-week allocations, and so we can't schedule out appointments beyond really next week. So anything,
All right.
clarifications on that, Jill?
No, I think you got it.
I think, Jill, you need to tell us how many arms have been poked by all the providers?
Do you know, I wish I could tell you that. Our firewall was updated and I can't get onto the state's website to see the number of people, the number of doses administered. I think is it over 40,000 now? Do you know, Ryan?
Yeah, and I have some stats as well. So as of yesterday, and it's broken for me today as well, so I can't get to it. But as of today, or as of yesterday, we had 40,422 vaccinations had been administered to Nevada County residents. Based on assuming we're consistent with the state and the data that they have on the dashboard, if you look at the percentage of those people who are 65 and older, that comes out to around 59% of the 65 plus population that would have had at least partial vaccination, with around half of those being partial and or one shot and half of those being fully vaccinated. Again, assuming state that we're consistent with what's going on at the state level. And then for over 16, of course, it's much smaller because that's a bigger slice of the population. It would be for our total population around 15% partially vaccinated and 17% fully vaccinated. So we're certainly making progress. We are fairly consistent with the state in terms of the percentage of our population that's received at least one dose. So,
yeah. And yes, and the state says that we are working on fixing an error with this chart. So it's not just you, it's everybody. But at least so over 40,000 doses administered. I mean, that's a milestone that's worth celebrating. And what better way to celebrate with a clinic? How about that, Dr. Evans?
Yeah, I was going to say, I mean, I have breaking news too, but it's probably not nearly as exciting as the breaking news Ryan just gave. I feel like he had the good stuff. But this is good news. So tomorrow we are going to have a clinic at the hospital that we weren't originally expecting to have. This is a county clinic. So we're going to do, well, it's a community clinic. It's our clinic, but we're doing the whole community that is in the eligibility that Ryan just went through. So if you are over the age of 65, or if you have a predisposing medical condition and you're under the age of 65, or you're one of the workers that is in the groups that are considered eligible at this point in time, then you can get a vaccine tomorrow at the hospital. But you absolutely have to make an appointment. And I'm going to give you a phone number, so get your pencils ready. 737-6233. I'm assuming that's area code 530. I'm sure it is.
It is.
737-6233. So you've got to make an appointment. So don't just show up for it, and then we'll get you in. I think we're doing 400 doses tomorrow here at the hospital, so that should help a little bit. And then, as Ryan talked about, I think when the supplies really start increasing significantly and the tiers open up, I think it's going to really be a game changer. So I'm pretty excited about the news from the state today. Otherwise, I don't have anything too exciting to share. We've seen kind of a, at the hospital, you had a few patients admitted. We've sort of been kind of bouncing around 2, 3, 4 patients admitted all the time. But I am a little bit nervous about what I've been hearing anecdotally about some cases popping up in Placer, and I'm hoping that we don't see any kind of a surge as a result of people relaxing some of their precautions. I don't know if we're seeing anything like that, Jill, but definitely want to keep our focus on prevention.
And Jill, do you have anything to add there?
I was going to say it's a great message because, I mean, really the reason we qualify for the red tier right now is because the state changed the criteria. So we still have cases coming in every day. So prevention is still the key to remaining in that tier and moving out of that tier into a less restrictive tier. It is exciting that the hospital has a clinic this weekend. We had a mass vaccination clinic last weekend that went really great. We were fortunate to be able to use the Johnson & Johnson or the Janssen vaccine, which meant that as a result of that clinic, we have 550 people who are fully vaccinated. And so again, with partners like the hospital and other vaccinating partners in the community, we're making progress, and that should be celebrated.
We're not, we had mentioned previously that we would be finding out potentially on March 23rd whether we were getting any more Johnson & Johnson, and it appears we're not getting any in the coming week, and we wouldn't expect any really until April or possibly even May, based on the way the state's currently distributing. Is that accurate, Jill?
Yeah, the state got some this week, but Nevada County did not, and because it's such a small amount, yeah, we don't know how long it will be before Nevada County gets any more of the Johnson & Johnson vaccine. So to say 4 to 6 weeks is probably safe.
But meanwhile, as long as there are other doses, Moderna, Pfizer, appearing, I think that it's going to go great, and people then can take advantage of the various ways to where they can get it. So, of course, with the clinic at Sierra Nevada Memorial tomorrow, Documos, who has a new online appointment system, and if you go to Documos website, you can book it right there. And Jill, you are releasing all your appointments for the Whispering Pines Clinic tomorrow at noon, every Friday at noon, right?
Correct. Friday at noon. We want to create that predictability. So please go online and schedule those appointments. They fill up pretty quickly.
Yes, and just as a reminder, you have to go to myturn.ca.gov, or you can call 1-833-422-4255. And for the Truckee area, Tahoe Forest Health System, they post their appointments on their website. And the Truckee Safeway posts appointment as well. And the county also has a page with all the vaccine providers and you can go to mynevadacounty.com/vaccine, and there you will find everything. So, and again, for now, it is people 65 and older, and those who are in the Schedule 1A and 1B. And starting April 1st, it's going to be everybody who's 50 and over. Yay. And starting April 15th, it's everybody 16 and over. Of course, always depending on supply. We got a couple of questions ahead of time, and several of them were about the, at what percentage of the rollout will the next tier be open for vaccine? Are we still going with tiers, or is now that everything's going to be open on April 15th? It's just the tiers are gone, no more phase 1, 2, whatever?
Yeah. Phase 1B is already open. So everybody who is in the those sectors is eligible. That's 65 plus, and that's also emergency services, food and agriculture, and education and childcare. Beyond that, it is completely age-based, and so now we have now we have from the state the dates that we know that everybody 50 plus will be eligible. That's April 1st, and everybody 16 plus will be eligible April 15th, and that's regardless of where you work. That's everyone.
Okay. And another question is, what is the plan or the priority for public health for assistance to the homeless in shelters, cars, camps, where what has been done so far? And internet and phone might be problematic for unsheltered people. So what's the way to approach them? Where can they ask for assistance? And what about the REACH teams?
There was a lot in there. I'll try to tackle
I
most
have
of it.
two more on that.
Okay. So in terms of people who are experiencing homelessness or those who are unhoused, public health has been working with Hospitality House and other providers who provide services to those who are unhoused or those who are experiencing homelessness. We work closely with the home team as well, which is under behavioral health, to provide vaccines to them so that they can go on site and vaccinate folks. We also sent our nurses to the warming shelters that were held recently by the county so that we could vaccinate people who sought shelter there at the warming shelters. So we continue to do outreach through our partners, and we try to accommodate their requests. Some want to administer the doses themselves. Some prefer to have a certain provider do it, so we can either work with that provider to make sure they have the vaccine, or we can send our nurses in as well. In terms of kind of outreach to folks who don't have that internet connectivity, that's a real challenge for us as a community, and really a challenge for huge parts of the state that don't have good internet connectivity, since the state is relying on that My Turn system. As you indicated, Pascal, there is a toll-free number that one can call to schedule an appointment. But the other thing that we tried to work on here in Nevada County was really to develop a network of healthcare providers so that they were vaccinating their own patients. So thousands and thousands of people were contacted by their healthcare provider to schedule appointments. So hopefully a lot of people who don't have good connectivity got vaccinated that way. And right now we're also, again, working with community organizations who can help inform us, help identify people who may be homebound or others who don't have access. And we're working on systems for that. So yeah, it's a work in progress, and it's a heavy lift, but it's one that we are charged with and we happily take on. So again, our REACH team has been out. They have vaccinated at some mobile home parks. They have vaccinated at some of our community partners locations. We've engaged some of the senior outreach nurses who have also been able to vaccinate some homebound individuals. And we're working on both sides of the county, again, to address the homeless population. I'm not sure if I covered everything you touched on, or if I covered it enough.
I think so. Another question also with regards to unsheltered people, homeless people, is are there any funds available to provide housing vouchers for a couple of days for homeless people after they are getting the vaccines? Because if they don't have any shelter support, just if they have some reaction, are there any vouchers available? And if so, where could people get them?
Yeah, I mean, that's a great question, and something I can bring back to our homeless team as well, as they're out there liaising and helping to connect people with the vaccine, that they're supporting people in those placements. Absolutely, we have quite a bit of funding that's come down from the federal and state government to assist with sheltering homeless people during COVID, and so certainly, so 211 is a good place to call if people have an immediate need for connection to those resources. Also calling our home team, and I don't have the phone number in front of me, but I will try to get that. So.
And another question is, I am fully vaccinated and want to volunteer my time. Where do I sign up? How can I help?
So we have such a generous community, so many people who want to help out. So I think that as additional providers get onto the My Turn system, there is a volunteer component that's connected to that. And so other vaccine providers in the community may be able to bring on volunteers in that way. We as a county organization, we only utilize volunteers who are signed up in the Disaster Healthcare Volunteer Database. And that can be found at healthcarevolunteers.ca.gov. Again, healthcarevolunteers.ca.gov. And so again, as a county organization, that's where we draw our volunteers from. But I will say, because we've gotten support from the state and support in other ways, we haven't had to tap into the volunteer database as much as we anticipated when this event began, or when our vaccination efforts began. So I will ask people, if you do want to volunteer and if you do sign up, please be patient. We may not call on you right away, but there's a good chance we'll call on you at some point. So again, we're just not able to use a lot of volunteers right now because we have some supports from the state, but that could change.
And any volunteers needed at Sierra Nevada?
You know, we're sort of working with the same list. We have some internal challenges with actually using that list of volunteers. And for now, we're using our own staff for the vaccination clinics and medical staff members. So we have quite a few actually physicians who are on staff that are willing to volunteer to do injections and the vaccine work. So that's been helpful. But I think that more broadly, the disaster volunteer database Jill just talked about is the resource that we want to tap into. While the supply of the vaccine goes up, I think we are going to run into a situation where more volunteers are needed. So I'm actually on that. It only takes about 5 or 10 minutes to sign up on the disaster volunteer website. So I would encourage everybody to do that.
Great. And Ryan, we have a comment in the chat box about homeless individuals, and hopefully they also have shelter if they didn't have vaccine and they get ill with COVID.
Yes, absolutely. That's something we've been doing from the beginning. And so I said I would circle back with the home team's phone number, and I'll just provide that right now. It's 530-470-2686. Again, that's 530-470-2686. And the home team, as Jill mentioned, is funded through the Behavioral Health Department. It's a collaboration with Hospitality House and several other community partners. And they're a resource not just for what's being asked right now, but for anybody that's experiencing homelessness. They will liaise with people and connect them to services. And they've been doing a spectacular job. And we're lucky that we happen to have a medically focused homeless engagement team heading into a pandemic. And we were able to quickly put in place a plan to help shelter our homeless individuals. We've placed a number of people in motels, given that congregate sheltering is problematic during a pandemic, and so they've been working very hard to make sure that we're connecting people to shelter, and they also could be a resource along with calling 211 should somebody have that concern that they've just gotten their vaccine and they're unsheltered and will be potentially experiencing symptoms.
Yeah, and I just got a text from someone at 211. Reminding people that they can call 211 for referral to the REACH team if they're eligible. So by all means, and also if you want more information about that, 211 is a great resource to call, and it is Nevada County focused. From Nevada County, if you call 211, you will get the information about Nevada County. There's 211 services in other counties too, but right here, if you call 211, it will be Nevada County visit, and they have a plethora of services for, I mean, any questions you can have for accessing any type of services. They're really a great resource. So shout out to them, and they're always here with us in these meetings and supporting the meetings, answering questions. So thanks to everybody. And now we have this is an interesting question that is I don't think any of us have the answer, but I'm going to ask it. Is there anything that can be done about the people gathering at the Brunswick Basin that are disseminating erroneous information, according to this person? What can be done about misinformation or disinformation?
I have a lot of thoughts about this, but they're not about how to prevent somebody from speaking their views. I think that, I'm grateful to live in a country where people are allowed to express their views. But I have been alarmed by the lack of scientific literacy around this particular event, this pandemic, and also alarmed by the fact that people have difficulty sorting out what information sources they should utilize to learn about things that are scientific, like how a virus behaves and whether or not masks are effective and social distancing and things like that. And there really do seem to be a lot of efforts for disinformation to be given to people, especially on social media. Sometimes it appears to be willful, and other times it appears to be sort of accidental. So I think that, it should start a conversation about what can we do differently in terms of education of our community, starting with students in our public schools, but elsewhere, regarding how to improve scientific literacy, and fundamentally how to get people to understand how to vet their information sources. Because I feel like people now generally are getting information from social media and the comment section of various social media sites. And they also are getting it from news that might be biased. There's news sources that are biased and inaccurate, and it's difficult for people to tell if their particular news source is biased or inaccurate. And we need to figure out how to educate people on how to identify accurate, unbiased information sources, especially scientific information, so that we can make good decisions as a community, about what to do in the setting of a pandemic and many other things. So that's a concern I have. I'm sure that it's shared by others. But I'm glad the conversation is now starting, because it's very notable now. This disinformation that's out there, we really have to do a lot more to educate the people.
I mean, from a media perspective, all I can say is that, I mean, with the exception of really breaking news, if information is accurate, you will find it in more than one source. It's not just going to be one YouTube channel or one blog or one social media channel that will all of a sudden have information that nobody else has, that normally contradicts everything. That it's a lot like climate change. 99% of scientists agree that climate change is A, happening, and B, that humans have something to do with it. Our activities have something to do with it. And then there are still a few that, for whatever reason, have a different view. However, generally their proofs and their theories are, you can't reproduce. And science is you make a finding and then you can reproduce it over and over again. So that's what science is. One of the things, for example, it's like, well, these vaccines are not 100% effective, but right now, all three of the vaccines, the Moderna, the Pfizer, and the Johnson & Johnson, are 100% effective at preventing severe disease 6 weeks after the first dose for the Moderna and 7 weeks after the first dose for Pfizer and Johnson & Johnson, of course, which is just one dose. 0 vaccinated people in any of the trials were hospitalized or died of COVID after the vaccines had taken full effect. And that's not Pascal from Ubernet that's saying that. It is life science. It's the Poynter Institute. So that's factual information. And another factual information is that Sierra Nevada Call Center is getting a lot of confused callers between the clinic, the current eligibility, and the announcement of the new eligibility. So Brian, maybe can you just go over one more time for tomorrow, what are the criteria?
Sure, and Ryan, you'll back me up on this if I mess it up, I hope. Yeah, so the eligibility hasn't changed yet. There will be some new eligibility rules coming up on April 1st. But for tomorrow's clinic, we're still in the mode of eligibility is restricted to individuals that are 65 years of age or older, or if you're less than 65 but have a medical problem, a chronic medical condition that raises your eligibility, then those folks can get vaccines as well. Or healthcare workers, first responders, food workers, childcare workers, and teachers. Am I leaving anything else off the list there, Ryan, or did I get it all?
Agriculture, and I mean, what I would really do is refer people out to the state's COVID website where you can actually see that guidance. And
Yeah.
if you're not sure whether you qualify as emergency services, they have that all spelled out. So that's COVID, what is it? COVID19.ca.gov.
Yeah. But if you're less than 65 years of age and you're healthy and you don't work in one of those high-risk occupations, then you're not eligible for a vaccine yet. Those eligibility rules will change on April 1st. I think the big change there is that if you're 50 years of age or older, you're going to be eligible. And then on the 15th, they change again so that anyone who is an adult will be eligible.
That's correct.
And again, I think all these the criteria, etc., everything is listed on the county website, on the state website, also in the news release that the county PIO team has pushed out, and that we were all very happy to repost and share the good news, because actually these past couple webinars we're sharing more and more progress and actually good news. So I think that's really something that should be highlighted. But like was mentioned at the beginning, there is still we can't just like burn the masks and have a party when we're not there. So can we just maybe get a so yesterday I believe it was what 10 new confirmed cases, and now with 10 cases we're still in the red tier, especially with the new red tier. So and by maybe in next week or the week after, California will have reached the 4 million threshold. Ryan, maybe can you give us where we can go after that?
Yeah, so I mean, first of all, if we hit a case rate of 10 per day, we're going back to purple, let alone staying in red, because 10 is the threshold for purple. Typically, the data, the way the state computes it, is slightly lower than kind of what shows up on our dashboard due to timing and some other things. But so yeah, the state adjusted the framework based on 2 million vaccine doses having gone to the quartile of people who are in sort of a lower socioeconomic zone. And so once that threshold hits 4 million doses, which is, if you calculate out from the current pace, should be in the next week or two, then the threshold to move into the orange would jump up. And so then I believe that would be 7, but Jill, correct me if I'm wrong. I think once we hit that 4 million dose target, then the case rate of 7 per day per 100,000 is what would trigger moving into the orange. Is it 6?
I'm looking at I just was able to pull up the blueprint for the safer economy. It says when California has 4 million vaccine doses administered in the HPI quartile 1, to get into the orange tier, it's between 2 and 5.9 daily new cases per 100,000. Okay. So basically 6. So if there's still work to be done. We have to get down to 6, and right now it's between 1 and 4. So that would be quite a ways. But it's doable. It's we can continue to wear the mask. And by the way, if, after you're vaccinated, what should you do? fully vaccinated, what should you do?
Well, I would just argue that people should still make really good decisions about their own risk and others. So, you know, the CDC has made some recommendations and they're available on their website where you can do things if you're vaccinated that you can't do if you are not vaccinated. When you're fully vaccinated, you can interact with people outside of your household. And even if they're not vaccinated, if they're in a low risk category, you can still have interactions with them if you are fully vaccinated. So I think that opens things up quite a bit for especially grandparents and folks that, you know, want to see their family members. But I think we all just need to be really mindful of the fact that we're still in a pandemic. We're still trying to drive this thing down. And so we shouldn't let our guards down too much. We shouldn't, you know, go into public areas without masks and gather indoors. I think that's the biggest thing that people need to think about. I've always said throughout this that it's hard to come up with a rule for every single situation that's going to happen. So that's why we need to rely on common sense and just think about what is my risk of getting this infection? What is my risk of spreading this infection? And just take steps to really try to slow this thing down.
All right. Well, I think we had our breaking news. I don't see any open questions in the Q&A. So I'm going to leave it up to you if you have any parting words of wisdom.
I'd like to throw one more thing out there, and that's backing up to a question that you asked earlier, Pascal. And this is really our PIO team who was pushing this message out. When you asked earlier about people who don't have internet connectivity and people who are struggling to schedule appointments for that reason, and they put out this message that I thought was such a wonderful one, which is if you do, maybe you can schedule an appointment for someone you know who needs an appointment. So a lot of this conversation has been about being a good neighbor, being a good informed neighbor, helping one another out, looking out for one another. And that's a terrific way to do it. So again, if you know somebody who doesn't have that kind of connectivity and you can go online and schedule an appointment for them, please do so. I know I've heard from some older adults who have had their grandkids go online for them. And I got my nephew to go online and schedule for somebody else. So again, it's just a nice way to do some additional outreach and to make sure that people are getting vaccinated for those who want to be vaccinated. So thanks.
And I would mark the 40,000 doses administered. If you go back to the presentations I gave at the beginning of this, 40,000 is around what the whole healthcare system typically administers in terms of flu vaccines for an entire year. And the healthcare system now, or with a limited number of providers coordinated through public health, we're now at 40,000 in just a few months. So that's a huge shout out to Sierra Nevada Hospital and the other providers, and then public health, which I think has done at least 500% of what they do in a normal year when it comes to vaccine delivery. Some health departments aren't vaccinating at all or are doing very little. And so our team and Brian's team and just a shout out to all the vaccinators who have played a part in this.
Yeah, I completely agree with that. And I just also say thank you to everybody for understanding that it's been a process. There's been a lot of logistical challenges and folks have exhibited a lot of patience with that. And I really do appreciate that. And then when vaccines are going into arms, there's a tremendous amount of gratitude as well. But we're grateful as well to this community for being strong throughout.
All right, with that, thank you, Brian, Ryan, Jill, thank you. And thanks to our live attendees. And we'll do this again next week. And we'll see what milestones Nevada County will have smashed by then. And if not, we'll just provide you with the latest factual information. So thanks, everybody, and see you next week.
Thanks, everyone.
Bye.